The local agents causing the local manifestations are called genital tract infections. The lesions which are common to both the sexes are genital ulcers, urethritis and anorectal lesions, and the female genital tract lesions are vulvovaginitis and cervicitis, whereas the male genital tract infections are prostatitis, epididymitis and orchitis. And some of the agents cause systemic manifestations which are HIV, hepatitis B and C. Today we will be talking about only the local genital tract infections and the genital ulcerative diseases. So what are the genital ulcerative diseases? These are syphilis caused by Treponema pallidum. Syphilis is one of the most important topics of your theory. Chancroid caused by Haemophilus ducreyi. Genital herpes caused by herpes simplex virus. This will be dealt in your virology class. And Lymphogranuloma Venereum or LGV, which is caused by the Chlamydia trachomatis, and Donovanosis caused by Klebsiella granulomatis. So, repeat after me. What are the genital ulcerative diseases? They are syphilis caused by Treponema pallidum, chancroid caused by Haemophilus ducreyi, genital herpes caused by herpes simplex virus, Lymphogranuloma venereum caused by Chlamydia trachomatis, and Donovanosis caused by Klebsiella granulomatis. Our genital tract infections which are common to both the sexes are genital TB and anorectal lesions. Now coming on to the genital ulcerative diseases. The genital ulcerative disease comprises of 5 important STIs: syphilis, chancroid, genital herpes, Lymphogranuloma venereum and Donovanosis. Now this chart is very important. Try to remember this by heart. This is present in your books also. Just remembering this chart will help you in answering all the questions of these genital ulcerative diseases. Coming on to this differences of syphilis, herpes, chancroid and LGV and Donovanosis. Incubation period. The syphilis has the longest incubation period of 9 to 90 days, whereas it is very short in herpes, 2 to 7 days, chancroid 1 to 14 days, LGV is 3 days to 6 weeks and Donovanosis is 1 to 4 weeks. Now what is the type of ulcer in syphilis? This is painless, single and indurated. Other painless ulcers are seen in Lymphogranuloma venereum and Donovanosis. Okay. So, but in herpes these are painful and multiple, bilateral tiny vesicular ulcers. Chancroid also is painful, is soft, multiple, purulent and easily bleeds. And LGV is painless, firm and single lesion. And Donovanosis, single or multiple. This is a beefy red ulcer that bleeds easily. So, among these genital ulcers, 2 of them bleeds easily. This is the chancroid, which is painful, and Donovanosis, which is painless. তাহলে ডিফারেনশিয়াল ডায়াগনোসিস করতে সুবিধা হবে কি? আলসারস গুলোর মধ্যে সবগুলো হচ্ছে পেইনলেস, পেইনফুল হচ্ছে হার্পিস, chancroid আর Donovanosis। ব্লিড করে হচ্ছে শুধুমাত্র দুটো, chancroid and Donovanosis। Lymphadenopathy. Syphilis has painless lymphadenopathy in non-indurated, firm and bilateral. In herpes is painful, bilateral, often with initial episode, and chancroid, this marked swelling leads to bubo formation which is unilateral. LGV is painful, soft and unilateral, and in Donovanosis the lymphadenopathy is absent. Now coming on to the treatment. The treatment for syphilis is penicillin single dose. Herpes, you know, is a viral disease, so it will be acyclovir for 7 to 14 days. And chancroid, it will be single dose of azithromycin. Lymphogranuloma venereum, the treatment is doxycycline for 21 days. And Donovanosis, it is azithromycin for 7 days. Now coming on to syphilis. Syphilis is caused by Treponema pallidum. The name pallidum has come from its pale staining property. It is not properly stained by gram stain. It was discovered by Shaudin and Hoffman in 1905. It is a thin, flexible, elongated and spirally coiled helical bacilli. The genus includes 3 species called Treponema, Borrelia and Leptospira. The treponemes are slender spirochetes with fine spirals having pointed ends. Tripos meaning turn and nema meaning thread. Most of them are commensals in the mouth and genitalia. Only a few species are pathogenic to men, which are divided into 2 groups: Treponema pallidum that causes syphilis, non-venereal treponematosis called Treponema partenii, endemicum and caratium. Now, mode of transmission, of course, it is most commonly it is venereal, and the non-venereal modes of transmission are direct contact, blood transfusion or transplacental. The Treponema pallidum penetrates through the mucosa or abraded skin, enters the lymphatics and the blood, then becomes systemic and causes the primary lesion. Incubation period we have seen, it has a variable incubation period of 10 to 90 days, that is inversely proportional to the number of organisms inoculated. তাহলে সিফিলিসের non-venerable modes of transmission কি? Direct contact, blood transfusion বা transplacental. Incubation period is 10 to 90 days. Coming on to the clinical manifestation, approximately 30% of the persons who have sexual exposure with an infected partner develop syphilis. Clinically, they pass from 4 stages: primary, secondary, latent and tertiary or late stages. And if transmitted vertically from an infected mother, the newborn babies develop a congenital form of syphilis. তাহলে সিফিলিসের কোন কোন 4টে স্টেজ? প্রাইমারি, সেকেন্ডারি, লেটেন্ট অ্যান্ড টারশিয়ারি। আর নিউবর্নের ক্ষেত্রে যারা ট্রান্সপ্লাসেন্টাল ট্রান্সমিশন হচ্ছে তাদের ক্ষেত্রে হচ্ছে congenital form of syphilis. In primary syphilis, this is the primary or hard chancre formed on the tip of the penis. This is a single painless papule, ulcerated and indurated. This is covered by a thick exudate rich in spirochetes. The common sites are penis, cervix or labia. This heals within 4 to 6 weeks. So this is known as the primary or hard chancre. Remember this. This will be a painless papule. Regional lymphadenopathy is there, painless, firm, non-suppurative and bilateral. And if acquired by non-venereal mode, primary syphilis is presented as direct contact, extragenital, usually on the fingers, blood transfusion. In blood transfusion, primary chancre does not occur. The secondary syphilis develops 6 to 12 weeks after the healing of the primary lesion. Skin and mucous membranes are commonly affected. Here you can see the skin rashes, especially on the hands. And another feature in secondary syphilis is condyloma lata. This is also important as a short note. So what is this? Condyloma lata. These are mucocutaneous papules that coalesce to form large pink to grey lesions in the warm, moist, intertrigonous areas such as perianal region, vulva and the scrotum, and mucosal patches, superficial mucosal erosions. In latent syphilis, there is absence of clinical manifestations, positive serological tests, normal CSF findings. The patient remains still infectious, transmitting the infection via the bloodstream. In latent syphilis, patients have one of the following fates. They develop into persistent lifelong infection, late syphilis or spontaneous cure. In late or tertiary syphilis, there are locally destructive granulomatis lesions in the bone and the skin. It affects the CNS or the central nervous system. In neurosyphilis, there is chronic meningitis, vasculitis, general paresis of the inside and tabes dorsalis. And cardiovascular syphilis, there is aneurysm of the ascending aorta and aortic regurgitation. So, in late stage or tertiary syphilis, this is affecting all our systems. Gamma, there is locally destructive granulomatis lesions in the bone and the skin. When it is affecting the central nervous system, there is chronic meningitis, vasculitis, general paresis of the intestine and tabes dorsalis. When it is affecting the CVS or cardiovascular system, there is aneurysm of the ascending aorta and aortic regurgitation. Coming on to congenital syphilis, this is another non-venereal mode of transmission. If an infected mother develops syphilis, mother to fetus transmission can lead to development of various congenital manifestations. So what are these? congenital manifestations. And coming on to the laboratory diagnosis, how will you find syphilis? Dark ground microscopy, direct immunofluorescence staining of the Treponema pallidum, and silver impregnation method by Lymphadenopathy stain or Fontana stain. In a dark ground, this will look like this Treponema pallidum. Spiral helical bacilli. Culture is not, this is not cultivable bacilli. Can you name another non-cultivable bacilli? That is the lepra bacilli. Okay, Mycobacterium lepra. This is also detected by serology antibody detection. There are non-treponemal tests and treponemal tests. What are the non-treponemal tests? These are the standard tests for syphilis using reagent antibodies and are detected by using cardiolipin antigen, and specific or treponemal test where specific antibodies are detected by using Treponema pallidum antigens. তা serology তাহলে আমরা অ্যান্টিবডি ডিটেকশন কিভাবে করি? দুই রকমের টেস্ট হয়। একটা হচ্ছে, ওকে একটু ফোনটা রাখতে বল, তোর পিছনে, তোর সামনে ফোনটা রেখে একটু দেখ। So in serology we are doing two types of tests. This is the non-treponemal or standard test and specific test. In non-treponemal test, reagent antibodies are used detecting cardiolipin antigen, and specific or treponemal tests are detected by using Treponema pallidum antigens. So what are these non-treponemal tests? These are VDRL or the VDRL, RPR or the rapid plasma reagent test, Tract, toluene red unheated serum test, and unheated serum reagent test. This is the VDRL test which is done in a laboratory. This will be coming in a practical examination. And the specific or treponemal test, here specific antibodies are detected by using Treponema pallidum antigens. What are these treponemal tests? These are the Treponema pallidum immobilization test, TPI, FTA-ABS or the fluorescent treponemal antibody absorption test, TPA or the Treponema pallidum agglutination test, TPHA or the Treponema pallidum hemagglutination test, and TPPA or the Treponema pallidum particle agglutination tests. তাহলে দুই রকমের টেস্ট, একটা হচ্ছে নন ট্রিপোনেমাল টেস্ট, তাদের মধ্যে কি কি রয়েছে? এই যে ভিডিও কল করছিলি এখন বসে বসে, এই যে ভিডিও কল, কি কি টেস্ট? নন ট্রিপোনেমা টেস্ট। হ্যাঁ তুই 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 ফোন করছিলি, তাহলে নন ট্রিপোনেমাল টেস্ট গুলো কি কি? VDRL, RPR, না তুই ব্লু তোর পিছনে যে, হ্যাঁ তুই 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 না, তোর সামনে তোর সামনে তোর সামনে তোর সামনে তুই 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 হ্যাঁ। So the non-treponemal tests are VDRL, RPR, Tract and USR, and the treponemal tests are TPI, FTA, ABS, fluorescent treponema antibody absorption test, TPHA, TPA, and Treponema pallidum particle agglutination test. Now what is the testing algorithm for this? The CDC recommends using a testing algorithm comprising of a non-treponemal test which is followed by a treponemal test. For the diagnosis of syphilis, in an area with high prevalence of syphilis, reverse algorithm is followed where a treponemal test is performed first followed by a non-treponemal test. And every pregnant woman undergoes a non-treponemal screening test at her first antenatal visit if there is high risk of exposure, again retested at the third trimester and at the delivery. যখনই কোনো গাইনোকোলজিতে প্রেগনেন্ট ওম্যান আসবে, আমরা তাদের প্রথম ফার্স্ট অ্যান্টিনেটাল ভিজিটে একটা নন ট্রিপোনেমাল টেস্ট করি, VDRL টেস্ট করি, তারপর তাদের আবার থার্ড ট্রাইমেস্টারে এবং একবার ডেলিভারির সময়তে একবার করা হয়, টু রুল আউট দ্য চান্সেস অফ কনজেনিটাল সিফিলিস। ওকে, and syphilis and both syphilis and HIV affects each other's pathogenesis. Now coming on to the second part of our discussion, which is the chancroid or the Haemophilus ducreyi. So what is this? This is a soft chancre, usually sexually transmitted infection that is a painful genital ulceration that bleeds easily. There is no inflammation of the surrounding skin and there is enlarged tender inguinal lymph nodes or bubo. তাহলে Chancroid বা Haemophilus ducreyi কি হচ্ছে? There is a painful genital ulceration that bleeds easily. There is no inflammation of the surrounding skin. There is enlarged tender inguinal lymph nodes or bubo. This is a common cause of genital ulcer in the developing countries. Transmission is predominantly heterosexual. Male is to female ratio is 3:1 to 25:1. The Chancroid also increases both the efficiency of transmission and the degree of susceptibility to HIV infection. ল্যাবরেটরিতে আমরা কিভাবে ডায়াগনোসিস করব? Exudate or swab is taken from the edge of the ulcer and the lymph node aspirate. In direct microscopy, we can see the pleomorphic gram-negative coccobacilli that occurs in groups or in parallel chains. They have a bipolar staining and in appears a school of fish or a railroad track appearance. তাহলে স্পেসিমেন আমরা কোত্থেকে নেব এটার কেসে? Swab is taken from the edge of the ulcer and aspirate is taken from the lymph nodes. In direct microscopy, we will see pleomorphic gram-negative coccobacilli that occurs in groups or in parallel chains. Stains has a bipolar staining and has a school of fish or a railroad track appearance. Culture, this requires factor X, hemine but not factor B. Rabbit blood agar or chocolate agar enriched with 1% isophytal X and it's selective made by vancomycin. Optimum conditions is 10% carbon dioxide with a high humidity and incubation at 35 degrees Celsius for 2 to 8 days. This is a biochemically inert. Multiplex PCR assay is also done for the sexually transmitted diseases. Drug of choice is azithromycin, 1 gram oral single dose. Alternative drugs are ceftriaxone, ciprofloxacin or erythromycin. And treatment of all the sexual partners is also essential. Now coming on to the herpes genitalis. This will be taught in your viva. We will be skipping this. This is caused by herpes simplex virus HSV1 and 2. The genital ulcers are multiple, painful, bilateral, tiny vesicular ulcers and there are bilateral enlarged tender lymphadenopathy. They have recurrent episodes, milder and recover faster than the primary genital herpes. And as you know, in herpes there is systemic symptoms like fever, headache, myalgia, dysuria, vaginal and urethral discharge. In laboratory, we can do staining of these lesions with the Giemsa stain and viral antigen is detected by or viral DNA by PCR from the scraping from the lesions. Multiplex PCR is also done and isolation of the virus is done from the scrapings of the lesions. Drug of choice is acyclovir or valacyclovir. In first episode, oral acyclovir is given for 7 to 14 days. Zovirax নামে যে ওষুধটা পাওয়া যায়, Zovirax 800 mg for 7 to 14 days. IV acyclovir is given in severe disease or associated neurological complications. In recurrent genital herpes, a short course of 1 to 3 day regimen is given. Now coming on to Lymphogranuloma Venereum or LGV. This is an invasive systemic sexually transmitted infection caused by Chlamydia trachomatis, serovars L1, L2 and L3. So LGV ki? LGV বা Lymphogranuloma Venereum. This is an invasive systemic sexually transmitted infection caused by the Chlamydia trachomatis, serovars L1, L2 and L3. The clinical course passes through 3 stages. In the first stage, there is painless papule, ulcer or vesicle on the penis or the vulva. In second stage, there is bubo, enlarged, tender and soft inguinal lymph nodes. Fistula, when the bubos break down, they cause discharge and spreads, causing chronic fistula and systemic symptoms are fever, headache and myalgia. In the third stage, if there is left untreated, there is rectal stricture or rectovaginal and rectal fistula, ichthyomany, edematous and granulomatis hypertrophy of the vulva, scrotum or penis, and elephantiasis of the vulva or scrotum. So in LGV also there is if untreated, there is elephantiasis of the vulva or the scrotum, and we have found where we have found elephantiasis in microphyllery বা Wuchereria bankruptcy. In phylloresis, also elephantiasis occurs due to chronic obstruction of the lymphatic system. তাহলে diagnosis কিভাবে করব? Diagnosis is based on serology. Biopsy is contraindicated due to risk of sinus tract formation. Nucleic acid amplification. In nucleic acid amplification test, Chlamydia trachomatis will be positive. Antibody detection is done by ELISA or microimmunofluorescence, and direct detection of the inclusion bodies is done by direct immunofluorescence or for culture confirmation. The test, skin test, এগুলো হয় না. Treatment, longer treatment course is necessary. Doxycycline for 21 days is the drug of choice. Azithromycin weekly once for 3 weeks is given alternatively. Now coming on to the final part of our discussion, that is Donovanosis. This is also called granuloma inguinale. It is caused by the Klebsiella granulomatis. Previously it was known as Chlamydia granulomatis. This was first described in Kolkata in 1882 by MacLeod, and Charles Donovan in Chennai demonstrated the Donovan bodies in a genital lesion. So what is Donovanosis? It is called granuloma inguinale. It was described in Kolkata in 1882, and in 1905 Charles Donovan demonstrated the Donovan bodies in genital lesion. This is prevalent in India, Brazil, Papua New Guinea and parts of South Africa. What are the risk factors? Poor hygiene, low socioeconomic status and multiple partners. Incubation, this has an incubation period of 1 to 4 days. The lesion starts as a painless papule, has a beefy red ulcer that bleeds easily when touched. Genital sites are prepuce, frenum and glans in men and labia minora in women. Pseudobuboes in 10% due to subcutaneous abscess. তাহলে ক্লিনিক্যাল ফিচার্স গুলো কি কি? ইনকিউবেশন পিরিয়ড হচ্ছে 1 to 4 days. মাথায় রেখো একটা পেইনলেস প্যাপিউল, beefy red ulcer that bleeds readily when touched. 90% ক্ষেত্রে হচ্ছে জেনিটালসে prepuce, frenulum and glans in men and labia minora in women. In 10% ক্ষেত্রে শুধুমাত্র ইনগুইনাল রিজনে pseudobubo হয় due to subcutaneous abscess. ল্যাবরেটরিতে কিভাবে ডায়াগনোসিস করব? A swab is taken from the granulation tissue. In direct microscopy, rapid GIMSA right stain is done. Donovan bodies are large cyst-like macrophages that is filled with deeply stained capsulated bacilli and having a bipolar appearance. These are non-motile, capsule and gram negative. তাহলে স্পেসিমেন কোথা থেকে নেব? আমরা সোয়াব করে নেব বা একটা গ্রানুলেশন টিস্যুর একটা পিস নেব। ডিরেক্ট মাইক্রোস্কোপিতে র্যাপিড জিমসা বা রাইট স্টেন করব। ডোনোভান বডিজ দেখতে পাবো দ্যাট আর লার্জ সিস্ট লাইক ম্যাক্রোফাজেস filled with deeply stained capsulated bacilli having a safety pin or a bipolar appearance, that is non-motile, capsulated and gram negative. Culture is done in egg yolk medium on an Hep2 cell lines. A molecular method, PCR, is done to differentiate the Klebsiella granulomatis from other Klebsiella species by the presence of the PHOE gene. Coming on to the treatment, azithromycin 1 gram orally once per week or 500 milligram daily for at least 3 weeks is given until all the lesions have completely healed. তাহলে drug of choice কি? Azithromycin 1 gram orally once per week অথবা 500 milligram daily for 3 weeks until and unless all the lesions have completely healed. Alternatively, drugs are doxycycline or cotrimoxazole for 14 days. Okay. Now, these are the genital ulcerative diseases. Please remember this all by heart. These are very important for your both theory and viva. And genital ulcerative diseases, এইটা কি অন্য কিছু ডিটেইলসে না পড়তে পারলেও এই চার্টটা বারবার মুখস্থ করে রাখবি, ঠিক আছে? This one chart will help you in understanding all the genital ulcerative diseases in the one go. Very important for the revision purposes. পরীক্ষার আগের দিন তাড়াতাড়ি করে পুরো চ্যাপ্টারটা পড়তে পারছিস না, শুধু এই চার্টটা পড়ে গেলেই হবে। আরেকবার পড়িয়ে নিচ্ছি। ইনকিউবেশন পিরিয়ড, ধর একটা লিশন নিয়ে এসেছে, লম্বা ইনকিউবেশন পিরিয়ড দেওয়া আছে, তাহলে মোস্টলি ইট উইল বি গোয়িং টু syphilis of 9 to 19 days. হারপিস আর Chancroid বা Donovanosis এর কিন্তু ইনকিউবেশন পিরিয়ড গুলো অনেকটা কম। Now this is the most important part. In syphilis the ulcer will be painless, single and indurated. তাহলে পেইনলেস আলসার আর কোথায় কোথায় হচ্ছে সিফিলিস ছাড়া? লিম্ফোগ্র্যানুলোমা ভেনেরাম, এখানে ফার্ম আর পেইনলেস আর সিঙ্গেল লিশন। আর ডোনোভানোসিসে কিন্তু পেইনলেস কিন্তু বিফি রেড আলসার দ্যাট ব্লিডস ইজিলি। সিফিলিসে কিন্তু ব্লিডিং এর কোনো ব্যাপার নেই। তাহলে পেইনলেস আলসার দ্যাট ব্লিডস হচ্ছে বিফি রেড আলসার, সেটা হচ্ছে তো ডোনোভানোসিস। আর নন ব্লিডিং হয়ে যাচ্ছে তাহলে সিফিলিস। ওকে, বাকিগুলো সমস্তই হচ্ছে পেইনফুল। হারপিসে অবভিয়াসলি ভেসিকলস থাকবে, পেইনফুল, মাল্টিপল, bilateral and tiny vesicular ulcers. Chancroid painful, soft, purulent, bleeds easily. এই দুটো হচ্ছে পেইনফুল। Now coming on to the lymphadenopathy. In syphilis it will be painless lymphadenopathy, bilateral. Syphilis এ দুই দিকেই হচ্ছে bilateral, non-indurated and firm. Herpes, Chancroid and LGV, all in these cases the lymphadenopathy will be painful. তাহলে একমাত্র পেইনলেস লিম্ফাডেনোপ্যাথি কোথায় হচ্ছে? সিফিলিসে। বাকি সব জায়গাতে কিন্তু পেইনফুল। হারপিসও পেইনফুল, Chancroidও পেইনফুল and Lymphogranuloma Venereum পেইনফুল। লিম্ফাডেনোপ্যাথি একমাত্র অ্যাবসেন্ট কোথায়? ডোনোভানোসিস বা লিম্ফোগ্রানুলোমা ডোনোভানোসিসে বা গ্র্যানুলোমা ইনগুইনালিতে lymphadenopathy absent. So in all these genital ulcerative diseases there will be lymphadenopathy except Donovanosis. Treatment in syphilis, drug of choice will be single dose of penicillin. Herpes, obviously antiviral drugs like acyclovir. In Chancroid it will be azithromycin single dose, Lymphogranuloma Venereum doxycycline of 21 days and Donovanosis azithromycin of 7 days. Okay.